it's true, to Denny's great amusement, my PhD is in systems engineering. So I actually come to this as systems engineer. And professionally, for the last 20 years, I've been a scholar of strategy and innovation. But that's not why I did any of this. It's not how Mike Porter and I got into this topic at all. When it comes to healthcare, everybody has a story. You do, or you have a close friend or family member or colleague who does. And they're really formative stories for each of us. In this work, it was my stories that drove the impetus for this work in the first place. I have 2 medically really complicated kids. The first one had open heart surgery in his first week of life. That turned out to be the easier situation. The younger one was chronically ill until he was 8 years old. He was in daily pain for 6 years. I was up 8 to 20 times a night, 7 days a week for 5 years before we got a diagnosis. And you know, it's amazing with the correct diagnosis how quickly a human body can heal and become totally well. I have 2 polite, kind, funny, high-achieving teenagers today. But wow, what a journey. Self-loading baggage. Boy, I'll tell you, we spent months and years as self-loading baggage. And it's a really, really difficult journey. I learned a lot of things in that process, but chief among them, the thing that resonated in my mind over and over again is surely we can do better. And that's where we started. How do we do better? A lot better, not just incrementally better. So if I think about stepping back and saying, what should we be thinking about? What do we want to be thinking about in terms of policy? 5 points. The first is, what's the point of healthcare reform? I mean, if you look at the newspapers, you're probably sitting there saying, well, is it more care? Or is it less care? Or is it cost reduction? What's the point? None of that's the point. The point of healthcare is health. Right. So the goal is to improve value, health outcomes, the results for the money spent. My then 8-year-old was looking at my work on the kitchen table at one point and said to me, Mom, what are you working on? And I said, well, I'm trying to figure out how to make the point for people that what you really should care about is value. And he said, as opposed to what? And I said, well, the debate looks as if the purpose were cost reduction. He said, Mom, if the purpose were cost reduction, when I show up for care, they would shoot me. Right. If the purpose were cost reduction, we'd need painkillers and compassion, and we'd be done. It's value. Health outcomes for the money spent. So that's where we need to be focused. And the good news about that is that quality, as Denny was talking about in the numerator, and costs in the denominator are interrelated in the following way. Very simply, it is inherently less expensive to live in good health than it is to live in poor health.